Hello, everyone. Welcome to the Tim Gut podcast. Today, I'm joined by a special guest, Brandy Kilmer. She is the community programs coordinator at Their Stories, Our Stories, and also the co-founder and senior director at Refugee Physicians Advocacy. Brandy, welcome to the show. Thank you for joining us.
Oh, it's my pleasure, and thank you for inviting me.
Of course. You've been on my list for so long. I know we're on the advocacy coalition together, and we've been working on a lot of stuff together. But you know, this podcast, first of all, I started it because I wanted people to share what's going on around the country when it comes to IMG advocacy and legislation around the country. Because I feel like sometimes we're all in our silos. Do you agree, Brandy? Like nobody.
Yes, yes, and it's great to see the momentum building nationally. Towards this positive legislation for the healthcare community as well as for international physicians.
Yeah. And Brandy, for people who don't know you and your background, can you tell about and a little bit about yourself? Why did you get into this space? A little bit of background about you.
Yeah. So I live here in Northern Virginia, just about 45 minutes outside of DC. And I really come from a non-medical background. I have been working in refugee integration since 2016 when I was living in Southern California, and really started teaching English as a second language in a local resettlement agency in Santa Ana, California at the time, and then mentoring a family who had just arrived from Iraq. The father of that family was an HVAC technician, and I tried to help support him in getting relicensed as an HVAC technician, and just seeing the difficulties of getting back into paying skilled labor jobs for the refugee community at large. And so I continued doing that kind of work here in Virginia when my family and I moved here. And really I'm on a volunteer basis. And so there's a large network here in Virginia with the Nova Friends of Refugees. We've had a great event around World Refugee Day that happened at the National Cathedral, where it was a very big community event to celebrate culture and artists and all kinds of food, and it was a great community event, and got connected with other nonprofits who were in the refugee community space. And through that effort, Their Stories, Our Story is an really sharing personal accounts of refugees who are ready to share their story to help the community understand what the reasons that a person might have to resettle into the U.S. or other parts of the world, being displaced by war. So through that, that's empathy building and advocacy building for refugees on a broad basis. We got connected with the Georgetown School of Medicine, and that first year program of the Georgetown School of Medicine, they need to choose the students choose a community-based learning project, and refugee health is one of the choices. And so I've been advising that cohort of first year medical students since 2020, and all of this kind of I really didn't intend to end up where I am, but it's been building from just really volunteering in the refugee integration space from that time that's led to where we are today.
Wow. And Brandy, have you ever said to yourself, what did I get myself into, when you saw all the complications and all the different barriers and all the alphabet soups, ECFMG, double A and
Right.
C and everything?
Well, like I said, I don't have a medical background. I've been called a doctor. I play one in podcasts sometimes,
Nice.
but no, um, it it's it's really the stories and
Mhm.
understanding um, really the value that these skilled medical professionals might be able to, and their desire and their passion for getting back into patient care. All of those have stayed with me and given me energy to help advocate for them. And I'm also a patient in the U.S. healthcare system, and
Mhm.
I benefit from not having long waiting times as a patient, and we can all benefit from the skills that they have to offer. So that gives me energy and hope, as well as this coalition that we've built here in the Washington D.C. area. We have really strong partners who, starting with Dr. Sarah Qureshi from the Georgetown School of Medicine, and she's brought in other practicing physicians who are likewise aligned and see the value that international physicians can offer, and they are committed to helping to bring down those barriers as well. So all of that, strong partnerships. We reached out to TIMGov early on, and you all supported us in that effort early on. So it's energizing to see the commitment and the progress that we've been able to make in a short period of time.
Yeah, can you talk about how, like, when the RPA was getting started, and was it only you and Dr. Qureshi, and or were there other people involved in bringing folks together and saying, hey, let's have a meeting about this, let's talk about this, and
Yeah. Go
can you talk
ahead.
about when was the coalition started before the provisional license, or was it after?
Yeah, we started before.
Mhm.
Initially we interviewed 7 refugee physicians. Dr. Qureshi had a few refugee physicians who had reached out to her for support throughout the years. And I had a few people from just my storytelling work, and Ken Spiker from the Nova Friends of Refugees. He's a co-founder of that organization. He knew a few folks as well. So we interviewed 7 doctors in that first year in 2022, and then it wasn't just enough to hear their stories. We wanted to do something about it. And so we started just feeling like if we reached out, there are other organizations who are offering support, but maybe we're all working in our own, like you said, silos.
Mhm.
Wouldn't it be better if we could partner together, and each other has different support programs and each other's strengths. If we could combine our efforts, then we can maybe make more progress. So um, you know Ken Spiker is an amazing partner because he knows so many people. He has connections across the community, and he knew of we reached out to World Education Services and Upwardly Global. Initially, those were our big, Upwardly Global offers career support.
Mhm.
We knew that we needed some kind of support to help with the USMLE preparation, study prep. So we were looking to you at TIMGA to offer that kind of support, and World Education Services is involved in all of the state's legislation, and had connections. He and Mike Zimmer at World Education Services, and Ken Spiker of Nova Friends of Refugees both had connections with Delegate Kathy Tran, who was willing to sponsor that legislation. We're fortunate because Delegate Tran, her father was a dentist
Oh,
in
wow.
Vietnam,
Mhm.
and it took him 14 years to reestablish a practice. And so Delegate Tran has personal proximity to this work, and so when so she's committed. She's very committed to moving this kind of legislation forward. So we got the mother load with her, and it's pretty unheard of for legislation to pass in its first year.
Yeah.
And we were able to do that here in Virginia last year with uncontested, with bipartisan support in the Virginia state legislation.
That's amazing, and some amazing partners as well that the RPA has put together. And shout out to Upwardly Global. I think they're celebrating their 25th birthday this year. So congratulations to Upwardly Global. They're doing an amazing job, and Wes and everybody. So that's great. So tell me, before the provisional license was passed, how did you guys get support for this type of work? I know Delegate Tran was leading the way, but like, how did you guys, like, as community advocates, like people who are not in the in the state house, how did you guys like get support from other medical leaders, stakeholders, the medical board, and like, how did you guys bring everybody together?
Well, I think having the Georgetown School of Medicine name got us in a lot of doors. Not a lot of people know who Their Stories, Our Story is, but yeah, Dr. Qureshi and the Georgetown School of Medicine, and Dr. Qureshi was just equally as committed and reaching out to other practicing physicians who might be able to contribute. We reached out to AMPA, which is the Afghan American Medical Professional Association. They were early partners as well. So it's sort of grown. I think every organization and saw value in what we were doing, and also had their own roadblocks of they could only get so far, and saw the value of forming a coalition. So I did have a volunteer with Lutheran Social Services employment specialist group. They had a small group of volunteers who had advocacy background before and legislation. So she really knew the ropes of how to build coalition support. At the same time, we only interviewed 7 doctors at that point, and we knew that there were others out there. So we were trying to build awareness amongst the refugee and international physician group as well, so that we could show that there's a pipeline and an opportunity available to medical employers. There was a need that, we're all nationally having a doctor shortage. So it seems very logical to put the two together. If we have international physicians who are skilled and underpaid and not able to get into the medical field, and we have a doctor shortage, it seems to be a no-brainer, especially, and that showed positive amongst the legislators in rural communities in Virginia as well.
Yeah, did you guys? Because I was very impressed with the work that you guys did. Because in the first year, as you said, getting a huge milestone legislation passed like this was amazing. For us, it took us a couple of years for us to grind it out to get like an alternative license pathway here in Washington State. Any pushback during those times? Did you hear any pushback from other folks or stakeholders?
Well, I think Delegate Tran worked on the pushback, and so again, every state has to find the line that they can draw in order to gain that support, and so they have to tailor the legislation in a way that meets all of the stakeholders' needs, so that they can find common ground. And so here in Virginia, the concession was that, at least the way that the legislation was written, was 5 years of medical practice in a country outside the United States, education from a university that was recognized by the World Health Organization, the ECFMG certification, and passing USMLE step 1 and step 2. So with that criteria, then the provisional license piece is 2 years of supervised provisional license time. And then after passing USMLE 3, then the physician can serve for 2 years in an medically underserved or rural community. So that's kind of the meeting of all of the needs, particularly the second part of that is the 2 years in the underserved community. So yeah. So that I think that brought in, we got the support of Cicero Institute, the Medical Society of Virginia, the Virginia Health and Hospital and Healthcare Association. All of those were big groups that had a lot of influence in the medical community.
Yeah. Awesome. Sounds good. So for people listening to this podcast, and maybe they're an IMG or maybe they're like an advocate trying to learn more about this provisional license, I know you mentioned some of the qualifications, but what does somebody has to, and some of the kinks and rules are still being put out there, but what does somebody has to do to qualify for this license? Is it just they have to have practice in their country for 5 years and do the test? Is that it?
Well, as I mentioned, so the 5 years of practice outside of the United States, obtaining the ECFMG certification, and the education that's recognized from a World Health Organization. They have a pretty robust list of universities that qualify, and passing step 1 and step 2. So from the refugee physicians side, it's a difficult. I mean, the exam is not difficult. The step 1 and step 2 isn't insurmountable. Taking the time to study for those 2 exams and having the discretionary money to pay for the fees or any of the programming, those are the biggest challenges. So we're still working on trying to find support to offer stipends or so on to physicians in that way. But other than that, that's the criteria. And right now it's in the Board of Medicine's rulemaking process here in Virginia, and we're the RPA coalition. We're staying engaged with the Board of Medicine because we don't want any more rules to limit that anymore, to cause any more onerous restrictions that are unnecessary.
Okay, well, let's address the elephant in the room, Brandy. Let's talk about those proposed rules. What are they? What are some things that the coalition is saying? Oh yeah, we can get on board with this. This is good. And what are like some concerns that you and the coalition are seeing from the proposed rules?
We've seen really great support. We've attended all of the Board of Medicine meetings, and there's broad support there. I think again, the Board of Medicine is also interested in addressing the doctor shortage, and at the same time, they want to maintain patient safety as same as all of us. So they're being very careful about the rules, making sure that they maintain the level of professional expertise in order to keep their credibility high, and I honor them for that. And we have, I've been able to gain a good relationship with the director, Dr. Harp, there at the Board of Medicine, and invited, if they've gotten inquiries, of course, about this. There's a lot of energy around these alternative licensure pathways. And so they're getting a lot of inquiries. And we invited them to send any of those physicians our way so that we can offer any support to them. And so we've gotten some referrals from Dr. Harp so that we can help these physicians be employable, the highest level of employability, so that the medical institutions see them as a value. But there's just recently there was a couple of rules, 3 in fact, that we are trying to advocate and persuade against. And I think honestly that the Board of Medicine wasn't really thinking about the refugee physicians who are already in country. When they were writing some of the draft rules that are in right now, I think they were thinking about international physicians who are outside of the country and can take step 1 and step 2 outside of the country before arriving. So the 3 rules that we're concerned about would be there's the language that is that the applicants should be no more than 2 years out of practice, and so that's the first rule. I'll just tell you the 3 things that we're advocating against at this point. And so it's no more than 2 years out of practice, and the language of another requirement would be the provisionally licensed physician must practice under direct supervision for the first 12 months. And then the third was having a provide evidence of authorization of proof of good standing to practice medicine in a foreign country. So I'll just address the first one, the no more than 2 years out of practice. Again, the argument for that the Board of Medicine was suggesting was I think the rationale behind that was that again, a physician can take it while they're out of country, and so it shouldn't, they shouldn't need any more than 2 years. And the longer, again, the contention is the longer that a person is away from medical practice, then their competency goes down. So we just feel that this disproportionately harms refugee and asylum-seeking doctors who face the long and unavoidable delays in reentering practice. And with the protection of it being a supervised 2 years, they are going back into patient care, but it is supervised, and they have 5 years of medical practice or more of experience. These are experienced doctors. They're not recent medical grads. So we feel that that's overreaching in being extra cautious beyond the need. So, and then also we just had asked the Board of Medicine to define what direct supervision. They had when they were talking about direct supervision for the first 12 months. Some of the board members were leaning towards line of sight for 12 months, and others were saying on site and available. And so we're just feeling like so that's still needing to be decided, and we're hoping that they will adopt the same standards as a residency, first-year residents, which the standard language for that is the minimum level of supervision for first-year residents is indirect supervision with direct supervision immediately available. So we don't think that it should be higher than what the medical residents should have. So, and allow that the medical institution, the healthcare institution that's hired to use their own discretion about, assessing the person's competency and then what the need for supervision is based on the assessment. So that's our hope with that one. And then the last one, allowing proof of good standing to be based on the most recent active practice. So a person who's a refugee physician likely won't maintain their active license after they've been displaced. And so that shouldn't count against them. But if they can produce evidence of having an active license from the most recent time that they were practicing that practicing medicine, then we feel that should suffice. So
Yeah.
those are the three things that we're hoping for.
Yeah, and I understand because I've seen a lot of bills around the country that mandate recent practice. Like you have to be been practicing within the last year or last 2 years. And I think it kind of forgets about, those physicians who've come here as refugees, as you said, who maybe came from war-torn countries. And a lot of like the evidence that people talk about, hey, like evidence of good standing. And I think I would argue for some refugee physicians, it would be even hard for them to get their license that they used to have, right?
Yeah.
Because their country, like it's a war-torn country now, and it's impossible to get those documents. So, and I talk to a lot of advocates around the country, and I tell them, hey, like when you guys are writing these legislations, or like you guys are helping shape these legislations, make sure that you guys advocate for the right things, right? Because later on, you guys might be excluding a large group. So have you guys had conversations with these type of, rulemaking process? Who had input in the medical board? Like, did you guys like attend initial hearings? Like, what happened? Like, who was behind like those initial requirements? Because from my experience in policy advocacy, there's always a group advocating for something, and there's always somebody like pushing back. So
yeah. So the process here in Virginia has been that the Board of Medicine published a notice of intended regulatory action, or NORA, and opened it up for public comment before they had drafted any rules. So it was just letting the public know we intend to follow through on the legislation that was passed for the provisional license for international physicians. And any comments that the public has, they can offer it now before we start the rulemaking process. They were actually drafting some rules before that, but we weighed in. There wasn't really anything to comment on, since the draft rules hadn't been published. But we invited some medical institutions to also weigh in and show their enthusiasm for the provisional license, and some did, and we did. We had some practicing physicians who were connected with us also put public comments, but also, like you said, there are outside groups. The American Board of Medical Specialties also has an interest. They've made a public briefing, I think in March, public, letting, I think actually they were showing support for these alternative licensure pathways. And also saying there's a disconnect on board certification, board eligibility with the provisional licenses, the alternative licensure pathways in states. And so, and recognizing that gap can be a challenge for employment equality opportunities. So that was good to see, but they also had a desire to keep things very, very strict and to secure the integrity of the board certification. And in their policy brief for board eligibility, they had indicated that board eligibility should be for physicians who are no more than 2 years out of practice. So that was something that we were thinking down the road that we wanted to address with the American Board of Medical Specialties. But the ABMS then also put a public comment in the Virginia State Board of Medicine public comment period during the notice of intended regulatory action. suggesting that the State Board of Medicine limit the license piece for the provisional license to no more than 2 years out of practice. So they're a large, influential group. And so that weighed heavily upon the minds of the Board of Medicine as they went in to these deliberations about the rules. And so, that makes it easy for the ABMS on the board eligibility if the states will just keep the same standard as they're hoping to, but it really limits and restricts those that might apply for the provisional license.
Yeah, but doesn't it make sense to make the provisional license a little bit make the red tape on the provisional license a little bit easier, so folks can qualify and get their 2 years recent practice before maybe sitting for the board? That because I agree, I think maybe yes, recent practice is important, right? But somebody who's out of school, because there's a lot of even programs here in the United States for physicians, board certified physicians, who've been out of practice. Maybe they had a family emergency, or maybe they were doing another business, or some kind of life event happened. So they
had
were
a baby,
had a baby, exactly. And then came back. They did a program through the medical board, and they do to get that recency of practice. So I don't know why the same thing can't apply to refugees and immigrants, and which is kind of like a double standard for me. Hey, you guys are breaking down, creating barriers for the provisional license so people can't get that experience to do the boards.
Exactly. And we're viewing the provisional license period equivalent to a comparable to a residency program, and actually it's actually more than that, because they're doing the 2 years of supervised practice, and then 2 years additional in a medically underserved community. So it turns out to be 4 years, right, of practice before they receive full unrestricted license. So I would hope that we are successful in persuading not just the state medical board, but also this question on the board eligibility.
Yeah. And Brandy, if anybody wants to help out or wants to maybe join the Refugee Physician Advocacy Coalition, or maybe wants to provide support in any way when it comes to these rules, or advocating for doctors in Virginia, how can they reach you, and what can they do?
Yeah, thank you for that. We have, I think we have the strongest influence if we have practicing physicians or people from the medical community. They will have the strongest impact in weighing in with the Board of Medicine. So we welcome any support that anybody wants to offer, but I think for anybody linked with the medical community will have the strongest impact. So between now and the next Board of Medicine meeting, which is September 5th, we're watching for the public comment period to open up. They allow in these legislative committee meetings, they have a public comment period that is at the beginning of the meeting. So we'll be making a public comment during that period, and we'll be sending a letter in advance. So we're inviting folks who want to sign on to our recommendations on these 3 items to sign on to our letter, and they can reach out to me at probably easiest to remember, RPA Coalition at tsosrefugees.org. So that's the email address that they can reach us at if they would like to see our letter of recommendations, recommended revisions, and interested in signing on. We also are inviting folks to join us in person at that September 5th meeting in Henrico, Virginia, where the Board of Medicine meets. And I can give you details about that if you reach out to me at my email address. But and then beyond that, the public, the public interest is also going to be helpful on the employment side. We're still, we're hopeful that this is going to be an active license. The Board of Medicine will start issuing licenses in Q2 or Q3 of next year. So we're also really advocating with the healthcare institutions to seek out their interest in developing supervising programming for the provisional license and issuing, and we're helping international physicians who qualify for this to be prepared and get medical experience so that they are more appealing to the medical employers. So any of those initiatives that anybody wants to help support, we're doing all of those, working with the international physicians, we're working with potential healthcare employers, and with the Board of Medicine.
Yeah, that's amazing. And I'm looking forward to having you again on the show when it comes to implementation, because I know that's a beast in itself. But I know you guys are going to kill it, and because you guys have the right people and the right, people who care about the issue to tackle this situation. Brandy, one last question before we let you go. Any advice for anybody, starting this out in maybe another state who wants to help, local doctors, immigrant doctors or physicians be able to practice? Any advice you would give them?
Yeah, I would say again, early on, Dr. Qureshi set up a monthly Zoom call. So we have a standing meeting that's the second Tuesday of each month at 4 p.m. Eastern time, and we just started meeting with whoever is interested and kept inviting more and more groups of people to help contribute. And that's worked well. And we just continue to be amazed at the people who are interested and aligned with our initiatives and want to contribute. So that would be a recommendation I would have, is to host have a standing meeting, and whoever shows up. I've been fortunate to have the free time to just send out emails and agendas and push the movement forward. Even though I don't have the medical expertise, I recognize that Dr. Qureshi and her colleagues don't have a lot of time to do that. So that's the piece that I fulfill, is just taking notes and doing the communications, and I find that to be helpful. And again, if folks have strong have a university, a medical school that they can connect with. Again, that's been a really a great benefit to us being able to have influence and get our names out.
That's Brandy Kilmer, everybody, Community Programs Coordinator at Their Stories, Our Stories, and co-founder and Senior Director of the Refugee Physicians Advocacy Coalition. Brandy, thank you so much for joining us. You are doing such an important work out there, and I'm looking forward to, continue working with the coalition and continue working with you to ensure this program becomes successful.
Thank you so much. Good luck, everybody.
Thank you.